So following the neuro-ophthalmic examination and prior to examining the globe itself, this is where you might want to do a palpebral nerve block. Basically, a horse who has a painful eye is going to be able to keep their lid closed over my best attempts to keep the eye open. Okay, and so what we want to do is take away some of that power of the orbicularis oculi muscles to close the lids. And we're going to do this using lidocaine and do a palpebral nerve block. So basically what we're going to do here is block the palpebral nerve as it comes across the zygomatic arch right up here at the very, very top. Or some people like to block this down here at the supraorbital fossa area where they can palpate the nerve rolling underneath. So here I've drawn up 3 milliliters of 1% lidocaine. I like to use a small needle. I like to use a 25 gauge needle. I'm kind of empathetic for my patients. It's a whole lot less painful if you're poking around with a smaller needle than a larger needle. So now we're going to do the palpebral nerve block so that we can hold the lids open without putting excessive pressure on the globe. We'll be able to see the patient's eye better, be able to check pressures, do minor surgical procedures, etc. Some people like to use saline, some people like to use alcohol to wipe over the area that we're going to basically be injecting. You got to be careful with alcohol that you don't get it actually in the eye. I'm going to use saline here. Basically, I'm just going to wet my gauze down here real good, and I'm basically going to wipe this down, getting any dirt and debris off. Also mats the hair down a little bit if you've got a horse in the middle of the winter with a big full coat, so you can actually see as well as palpate your landmarks. I'm going to take my lidocaine. I'm going to palpate the nerve here. And I usually pinch directly over and lay the needle sticking. And then I'm going to massage. And the massage will spread the lidocaine over the nerve. And when we have adequate akinesia, the horse will be able to lift their upper lid, because that's a different nerve. That's the third cranial nerve, the oculomotor nerve. But they will not be able to spasm the lid like we were showing before. And so we'll be able to open their lid a whole lot better.